Welcome, everyone, to today's webinar, The Promise and Peril of AI in Healthcare. On behalf of Becker's Healthcare, thank you for joining us. Before we begin, I'm going to walk through a few quick housekeeping instructions. We will begin today's webinar with a presentation, and we'll have time at the end of the hour for a question and answer session. You can submit any questions you have throughout the webinar by typing them into the Q&A box you see on your screen. Today's session is being recorded and will be available after the event. You can use the same link you used to log into today's webinar to access the recording. If at any time you don't see your slides moving or have trouble with the audio, try refreshing your browser. You can also submit any technical questions into the Q&A box. We're here to help. With that, I am pleased to welcome today's speaker, Chris Logan, Senior Vice President and Chief Security Officer at Censinet. Chris has more than 25 years of experience in IT operations and strategy. Previously, he was Director of Global Healthcare Industry at VMware, where he helped healthcare clients achieve their strategic outcomes by implementing the company's industry solutions. Prior to VMware, Chris was the Chief Information Security Officer for Care New England Health System located in Providence, Rhode Island, where his role was providing security and technology leadership and enabling positive business outcomes for the organization and its partners. He has also worked in security leadership roles at Lifespan Corporation, Century Bank, the Massachusetts Institute of Technology, and he served in the United States Marine Corps. Chris is also a professor at Providence College in their School of Business, where he provides instruction to graduate students on the management of technology and operations and service management. Chris, thank you so much for being here today. I will now pass the floor over to you to kick things off.
Thanks for that introduction, Riz. It's humbling to hear it, all the experience that I've had in this space, and I'm glad that I have the opportunity to speak with everybody today. And it really is just that, it's a discussion. It's an observation of where we're at from an industry in healthcare, and where the crossroads of AI is really starting to permeate itself across what we're doing to provide patient care or within business operations. So first and foremost, let me thank you all for taking time out of your busy schedules to engage in this conversation with me. And I promise I'll leave some time at the end to answer those questions that you put into the Q&A box. I feel like we've been here before. Now, this is not a jab. The slide that was provided here is not a jab at any company, any organization that had gone down this road before. But there was always a lot of promise that we had seen, especially in healthcare, about what could we do with the advent of artificial intelligence and machine learning. You know, I think all the intentions were right. I think they were correct. I think if you look at what we're trying to accomplish from a mission perspective, it's really to provide better outcomes for patients. So using technology to provide those outcomes makes complete sense. Were we too soon? Was the technology not quite up to par yet? Potentially, right? And I think there's a lot of lessons that we can learn from the past. This was not that many years ago about how do we start to move forward. And I think the critical conversation piece here is that we're seeing it happen all over again, right? Same bat time, same bat channel almost at this point in time of what we're looking at from how we're utilizing or looking to utilize artificial intelligence now to simplify our lives. And there's no shortage of news or hype that's surrounding this. And I think one of the most important accolades of this is that it is available to us now. And I see some great opportunity with it. But with that opportunity always comes risk. And I think what we need to do as organizations or even as individuals is really start to understand what the risk actually is. Now, there's a lot of it out there. My hope is that we cover just a good chunk of it, but just know this isn't all encompassing. The risk is going to change. It's going to be very dynamic. If you think about the ways in which we use AI, me personally, my personal life today, I'm using it for operational advantage. I still have to double check that work. I still have to make sure that I'm paying attention to what that output is, because there's still question marks surrounding how that outcome came to be. But I still see a great value with this. And what I think we can do is really learn from our mistakes from the past. So my hope today is that we go through what are the opportunities? What's that vast landscape of opportunity that AI presents in healthcare, the promise, so to speak? and then look at a few areas where, there's just some things that we have to really go back, dot the I's and cross the T's on to understand and ensure that we're managing risk appropriately within our organization. One, so that it doesn't impact and affect the patients that we're trying to serve. But two, it doesn't hurt the business that we're trying to pursue at the same time. So let's dive right in. Let's look at that vast landscape of opportunity. And again, these are many. There's a lot of potential benefits and use cases for AI in healthcare. If you think about what we're seeing on a day-to-day basis, what's happening in the marketplace, there's a lot of new opportunity for treatment and diagnosis that's starting to hit the market. And I think we're starting to see a lot of folks really lean in and take advantage of those opportunities. We're seeing a lot more in the operational side of the house, though. And again, I think that's because as you think about what the risk that brings to this is that it's just a simpler, safer path for us from an operational perspective to really start to streamline some of the efficiencies and effectiveness that we see with technology and really amplify how powerful those tools are. And if I think about this from a second perspective and looking at it from how it can really impact patient care, think about with advanced diagnosis or early detection. This is a very powerful tool when you start to think about what we can do in the way of preventative medicine. It's a very powerful tool when you start to think about the vast variability of the complex human being and what that means for a treatment based upon that diagnosis and being able to provide that in a real-time fashion based upon some of the workup laboratories and results that we have gotten from all those other procedures. There's no shortage of potential here. Again, I can't stress that enough, is that the promise of this technology is really far, far advanced from where it was just a few short years ago. That does create additional opportunity, though. One thing that I want to be wary of is that we should be optimists when it comes to AI and how AI traverses our lives and even crosses us in our business day to day. But we have to be cautious with that optimism, right? Again, we're going to see a lot of opportunity to improve outcomes for patients. And I just want to give a few examples here that we've uncovered in our research related to things like breast cancer detection or advanced alert monitoring for specific patients, or even predictions of specific diseases. And in these case studies, they saw significant improvements in those outcomes. This is very promising, right? And it's clear that organizations are going to be adopting AI at a breakneck pace and speed, right? It's clear that AI is going to be here to stay, but it's one thing that it's not going to replace. It's never going to replace the physician, right? The physician's going to have to use AI going forward to ensure that they're keeping up with that latest and greatest and providing the best outcomes to patients. Those who aren't willing to adopt AI and become laggards there will get left behind. So it's important to have a very strong strategic viewpoint for how you're going to use AI in your environment. And we're going to cover some of that as we start to move along here. I talked about the good, and I hate to say this, I don't want to be a Debbie Downer here or be that voice of reason, but the peril's just as bad. If you think about the risks that this technology brings to bear, I just want to share with you some of those areas where we see that risk. And I'm going to go into some detail here. I'm going to spend a few minutes on these slides because I think it's quite important to understand what are those areas where we should be focused on from a risk perspective in our organizations. But not to fear, because one thing I will do is that as we talk about the peril, I'm going to share with you what we think some best practice are for organizations as they start to adopt this technology and what they should be focused on to ensure that this technology can stay relevant in their organization and still provide great value. So in this landscape of potential risk, just as vast as the promise, you have opportunities for misdiagnosis. You have the opportunity for an over-reliance on AI to provide recommendations, right? Healthcare is still human nature. It's still human factors. You still sit across from a human being, whether it's over a Zoom session or in an office. You still perform a procedure on a person. So over-reliance on the technology could become a downfall for the benefit for that individual as we're serving them or treating them or providing some form of service to them. It also opens up new doors. And I think as we started to digitize, and you can go back to 2009 when the American Recovery and Reinvestment Act came to bear and everybody was incentivized to adopt electronic health records, electronic medical records. It created a whole slew of security and privacy issues. And I still don't think we've fully gotten up to speed with dealing with those security and privacy issues. And as we adopt more advanced technologies, things like AI in these environments, it only enhances those security and privacy issues. And we need to be aware of those security privacy issues and understand what they are, not only to solve for the privacy and security issues that are facing your organization, but to be more preventative and create much more of an environment where you can adopt this technology in a seamless fashion where it doesn't harm the brand of your organization. And I think that's incredibly important in this conversation as well, because although there is the opportunity for misdiagnosis or a bad outcome for a patient, there's also a brand and awareness issue when it's related to your healthcare delivery organizations, right? Know this for a second, is that organizations in this space, patients don't have to come to you. There's options for patients when you think about it and how patients receive their care. One of the key factors when you start to think about AI as an incorporation into your strategy is that, what is it from that brand perspective, right? How am I dealing with this, not only from regulatory uncertainty, but how am I dealing with it from an ethical standpoint as well? Because individuals care about their information. And we're starting to see a lot more in this space as the healthcare ecosystem continually expands itself out into an environment where you're relying on other third and fourth parties to deliver that care. So let's dive into a couple of areas where I really want to uncover some of the risk and really start to think about what's happening out there and how we start to solve for these problems. So the first and foremost is that we're seeing AI adoption really take off in organizations. And what we're really concerned with here is that it's outpacing the organizational strategy, the organizational governance, and how we're educating our users on how to even use AI. Statistically, 77% of healthcare workers, they've tried some form of generative AI at least once. So it's now becoming very commonplace in our day-to-day lives, right? No different than how organizations use social media for marketing. People were there first, so they took it into their organizations, and that created an additional level of risk as well, right? So we're seeing that now start to bleed into this corporate environment. You're seeing much more of a fast pace of organizations or users within organizations that are using AI on a frequent or regular basis, right? And it could be all different forms of AI to perform a function personally for them or within their job without your notice. Also, we're seeing health system executives who believe AI has really reached that turning point. So there's a belief out there that artificial intelligence is really going to change how we deliver care to patients, how we run our business and operation, how do we improve patient outcomes in their covered lives. And then another piece of this puzzle, though, which is more concerning, is that even though 75% of those executives believe it's reached that turning point, only 6% have actually gone in and developed an AI strategy for their organizations. So what do we have to do as healthcare delivery organizations to really live in this promise of what AI can bring? First and foremost, you got to have a formal AI strategy in place. Without a plan, it's a fruitless endeavor. You have to have a plan for what it's going to mean for your organization, not just from a business perspective, but in that patient care realm as well. And as you create that strategy, governance has to surround it. You have to use this technology in a meaningful way. One, because it's going to be primarily used in the care of an individual or a patient, so you don't want negative outcomes for that individual. So having that governance structure surrounding it for decisions that need to be made moving forward about how it impacts your organization is critical. The third piece of this puzzle is education. One of the things that I know we strive and focus on as a cybersecurity practitioner is trying to get people to change in an organization and create a culture of awareness for cybersecurity. This is no different. This is now escalating it. So now it's not just a cybersecurity conversation. It's about what this could actually do, not only for the individual and themselves, but also for the organization and to that patient. Also, if we start to think about this, right, we're now adopting more cyber risk. And I can't stress enough that concept of digitization that we took on back in 2009 when every organization started to adopt an electronic medical record. And we're now seeing it outpace with what's taking place in this world of digitization where care is delivered far beyond the four walls of the hospital now. Cyber risk has changed. This landscape is going to continue to change. Are you changing with it? Or is it just passing you by and you're just hoping for the best? So, really paying attention to that cyber risk landscape, how it's shifting and dynamic, and addressing the concerns as they come up in real time, as opposed to waiting for something bad to happen. Being a little bit more preventative there as opposed to reactive. Finally, somebody's got to be accountable. At the end of the day, you can adopt all this wonderful technology, all this advancement, but who is accountable for it? So that has to come through that governance structure. You have to have that structure in place, whether it's a diverse set of individuals across your organization that solve this problem, that address the issue, and create the policies and procedures necessary. But somebody at that point in time has to be accountable for how it's going to continue to be used and populated across your organization. Other side of the coin is that we're seeing significant unknowns, right? So how is AI being trained? Now, this is not going to be a tech talk about how those models get created and how they grow. I just need you to be aware that that model, that service, that solution, that application that you're using doesn't just permeate itself. You have to feed it information for it to start to understand. So you create that model, that training model, and you're using a number of different data points with it. And hopefully it's the data that you have gathered over the course of the time that your organization's been treating patients, that your organization's been operating. In many instances, it may be brought in from other significant organizations as well. But there's key risks here when you start to think about all the different data types and the significance of the volumes of the sensitive data necessary to train that AI model to really get that proper output and outcome. So think about this for a second. Key risks and considerations: breaches. As I'm training these models and that significance of the unknown, what's in the model? What data is actually composed in that model to create that output? Is it protected health information? Is it conversations with individuals? Is it diagnostic results? Is it more sensitive data? If you think about the data that you're storing within your organizations that require an additional layer of protection, confidentiality, and security. So really start to understand what data is actually out there and how do I protect it? Do you understand also that you're probably receiving this service through a third-party vendor? Who are they relying on to train that model? Who are they relying on to provide that feedback for you? Right? Is it OpenAI, other large language models? Is it private? Is it public? Right? Are we looking at it from the auspices of, is it a black box? So is it going far beyond the third party into a fourth party environment? And what risk does that now bring up? Thirdly, what about bias? Now, if I'm not introducing diverse sets of information into the models that I'm training, am I creating bias? And what does bias mean for patient care? It could be significant if you think about treatment plans, especially with the variabilities of the human subject that you're dealing with. No two people are the same. I mean, we're similar, but no two people are the same. They're going to have different opportunities for different diagnoses and different treatment plans. So it's really imperative now to think about it from a bias perspective and what the data that's being trained in that model, what the output truly is. So again, key priorities for us to start to think about as we kick the tires on AI a little bit further and thinking about the training models is, what data is being used? Again, go back to that governance statement that I made before. It's really about the organization and who owns this, and then understanding the data inputs, how it's being used, how it's being obtained, stored, and transmitted. Also, really start to understand from a risk perspective who the third party is that you're doing work with in this space, and what are the cybersecurity controls, policies, and procedures that they're using. Is your data getting that level of protection that not only does it deserve, but is required? So again, key consideration here. And then understanding where that third or fourth party is actually utilizing that deeper large language model, whether it's black box or a publicly available solution, and where does it live? Just pure visibility into the entire process from beginning to end to really start to drive those unknowns and make them known when you think about the AI model training and data that you're providing. Next case and point here is poor visibility in the scope of the AI vendors and use cases. Now, I've already beat up the AI vendors just a little bit here, but I think what we're starting to see is that risk in general increases the closer you get to the patient. So think about the use of artificial intelligence chatbots, output that could come from that. Now it's directly attributed and correlated back to an individual. And what we're starting to see also is that patients are going out and self-diagnosing, right? So no different than when WebMD first came out. I have a bunch of symptoms. I go and look for those symptoms and I self-diagnose. We're starting to see many, many more people start to use ChatGPT and other solutions, not that I want to say it by name, but other large language models that are publicly available to self-diagnose. So we're creating risks the closer we get to the patient that maybe you're responsible for, or maybe you're not. I think those lines of delineation haven't been clearly set. So really setting those lines based upon the use case is going to be incredibly important. Another key piece of this thing is that, do you know all the vendors that you're using today that have AI embedded or are using AI in the back end to provide your services? So really going in and taking a look on those vendors and seeing where AI is pervasive across those products, services, or solutions that you're using. And then finally, again, we're getting closer to the patient. Patient could be self-diagnosis. We're over-relying on AI recommendations, right? We're taking humans out of the loop too soon. And again, patient care is a human factor, understanding who the individual is, their social economic status, what they're doing from a social perspective for preventative medicine and their personal care conditions, right? There's a lot of variability there. So we can't take the human out of patient care. They still have to be in the middle of that patient care. AI can help supplement what we do there. So how do we start to solve this problem again? Get to your patients, have a conversation with them, tell them about the promise of AI, but also inform and instill in them the peril of AI at the same time. As an organization, really create an inventory. Understand where AI is within your organization, those vendors who are bringing into your organization, and then also understand the use cases that you already have. Go get that inventory started, right? Put it through that governance process to see if it passes muster and that you can continue to use it. And then finally, assess the risk of those third-party vendors. Really expose where the fourth-party vendors are now, because it's not just stopping at that third-party vendor. They're going to be relying on somebody else to provide this service as well. So uncover and expose where that fourth party is as well, so that you can have pure visibility into those use cases and workflows for AI. What about bad actors? Right? As we shift and start to think about this a little bit deeper, we're seeing the bad actors taking a lot of advantages of organization every time there's an advancement with AI. One of the things that I'm seeing quite frequently now is social engineering, and it's coming so much easier to take advantage of the human. And I'll say this, that one of the biggest risks to any healthcare organization is always going to be the people who are providing the services. And I say this not tongue in cheek. I say this because I have this experience, and I've never met a nurse or I've never met a clinician who doesn't want to help. So anytime you have somebody that they want to help, it's just part of the culture of the organization, you have to take extra care when you start to think about social engineering attacks. Contextualizing deep fakes and threats to the organization, it's really simple these days for the bad actors to really start to take advantage of the human element or the risk that the human element brings into providing patient care, simply through whether email, advances in just websites, or even threat vectors that are expanding into that AI. So if I think about this for a second, we've seen no short of, this is just from January to February, the statistic here, 135% increase in social engineering attacks, and that are specifically using generative AI across just 1 month. That's significant. So if you think about that vast landscape and the opportunity, it can spread pretty rapidly across not just the United States, but across the globe. Other areas where we're seeing bad actors take advantage of the advances in AI, data input poisoning. Again, just the introduction of bad information, bad data into training sets. Really starts to think about this for a second, contaminating that model. Are you expecting a specific, accurate response from AI? You've trained it in a certain way. What happens when bad information gets in there? extracting models to pull information out and clone them so that I can gather your privacy and security information, all the way to inversion attacks or inference attacks, right? Extracting data sets, properties, and really extending them out to other models. So sharing your information without you even knowing it. That creates privacy and security concerns across the entire spectrum. So, and that's just scratching the surface, by the way. So those threat vectors, that's just the bare minimum. There's really a lot of other places where we start to see the bad actors taking shape and using the advancements in AI to start to attack organizations like yours. And finally, the last thing I'm going to talk about from the peril side of the board is model drift. Now, I'm not going to go into deep detail about model drift. Model drift really is just when the accuracy of prediction produced from new input values drifts from what the expectation is. Now, this can happen in an unintended consequence type of way. And this can happen even by introducing your own data into the model, right? Why it's important to know about this, why it's important to consider this as you think about the governance and how you're using AI, because you want to prevent unintended consequences here. So as you think about that governance and what it takes to run AI in your organization based upon use cases, you're also now going to have to monitor your model's performance. Monitor the output, ensure that recommendations are accurate and that they don't impact patient safety. Really creating a model and developing validation checklists into that model as well. Because again, you could introduce bias here, or you could introduce a lot of variation, which could create what? Poor recommendations coming out of the model based upon proper input. So you're going to have to think about this for a second and retrain those models to make sure, one, that you're minimizing false positive and negatives, but also on the second hand, to make sure that your models that you're utilizing to provide this service isn't degraded. And then also, you want to start to think about it. What do we do when we see outliers or anomalies within the expected data set? What's the next step that we take? From a governance perspective, from a policy perspective, it may be to stop. It may be to reconsider that model, reconsider how we're using it, and then retrain it. Finally, secure the endpoints to where the AI models are maintained. You want to make sure that they remain in full state of integrity, and then test. And again, this isn't reliance wholly on the machines or the AI or the ML. It takes humans, right? Don't take the human being out of the loop when it comes to understanding model drift. Don't take the human being out of the loop in the governance aspects of it, and definitely don't take them out of the loop in understanding the larger risk threats across that entire landscape. So I've gone through a lot of the bad. I've just touched on the good, right? So I think what we'll go into next is, what do we do, right? So I understand there's risks here. How do I start to address these risks? What should we be doing as an organization to manage healthcare AI risk across our enterprise? Well, we have a couple of areas that we're going to dig into. We have 8 specifically here. And I'll give you a high-level overview of each because I think it's incredibly important to really start to dig into how we manage or what the best practices are for managing AI across healthcare, managing that risk across our enterprise. So let's dive right in. Ensure risk visibility across all vendors and products. Now, this one's critical, right? And this is blocking and tackling as far as I'm concerned. You should have a digital inventory of all your third-party vendors. And in this case, you're going to extend this out. You're not just going to have a digital inventory of those third-party vendors, but also create that digital inventory of those AI workflows and tie them back to those specific third-party vendors. Now, I want you to be aware of something. This is not always in those technical vendors that you're using. It could be into non-technical vendors that are providing services to your organization as well. So you really need to have that full catalog or inventory of those third parties that are providing a product to your organization, that are reaching out and touching your patients, providing a service to your organization, right? Why this is important is because we're seeing a vast number of vendors now starting to insert artificial intelligence into their products. You need to know about them. Why do you need to know about them? They may be using your data. If you don't understand your contractual obligations with those third-party vendors, they could potentially be using your data to train models someplace else. You really need to get to the heart of that digital inventory, really start to understand where AI is traversing your organization from the technical all the way through the non-technical. You also need to understand a comprehensive view of your risk posture with those vendors in particular. As you're very well aware, this year we've seen an uptick in data breaches. We're now starting to see the pace of data breaches from the healthcare ecosystem or the business associate side outpace healthcare providers in general. You need to understand the comprehensive risk posture of these vendors. There's no ifs, ands, or buts anymore. This is a huge area of gap. This is a huge issue for visibility. Understand those folks that you're doing business with, not only from their business point of view, so who they are as a company, but also understand what about the product? What about the service? What's going on in there? Give me evidence about what this thing does. What is your policies, your procedures? Ask the right questions, get the answers, and validate those answers are true. And again, I can't stress this enough. This is only going to get worse if you haven't started. You need to start this now, because rapid expansion in healthcare AI market, it's not going away. We've seen more healthcare AI vendors come to the market in 2023 alone. We're seeing a ton of investment in this space, and a ton of deals have come across. As a matter of fact, it's almost like if you don't have AI built into your product anymore, it's tough to get those dollars out there to bring new products to market. So we're seeing a vast shift in organizations thinking about how they're incorporating AI into their products and services to deliver to you. Pay attention to this. It's quite important. Get that inventory started. So you have the inventory. Are you asking the right questions? Are you reaching out and understanding the use case and the service risk with those third parties? Are you capturing comprehensive risk exposure information? And this isn't tough. You just have to ask the questions. And not all questions are created equal either, right? It's not just about whether the product contains artificial intelligence. What are the use cases from your organization, and how is AI being deployed in that capacity? Does that product or service use sensitive information for training? Does that product or service use sensitive information in fourth-party services? And what services are they? More importantly, I think this is probably one of the most important elements here. What about the data itself? Is it de-identified? Are you comfortable giving de-identified data to those third parties so that it can help train those models? What's the chances of that data being re-identified? And what are the protections in place to really start to safeguard the data? One thing I'll start to implore everybody to start asking for when you think about those third parties that you're doing business with, ask them for a software bill of materials. What's under the cover? What's under the hood, so to speak, in that product or service that they're delivering to you? You should really start to understand this from a vulnerability perspective, because vulnerabilities happen quite frequently. There's a brand new dozen of them every day, and that's just to say the least, right? So what you really need to do is really start to understand what's under the covers in those products and services that you're using that could contain AI. And then also start to think about this where that fourth party risk comes from. So yeah, I may be contracting with company A, but they're using company B to provide that back end service. How many AI companies today, and as a question, are actually built on something open source? Have they done it privately? What about building their proprietary models? How are they being built? Where are they being built? Quite honestly, a lot of organizations just don't know what's inside their models today, right? They're just populating information based upon what's available to try to get to market quick. Really take a pause and dig deep into this use case area and this surface risk so you know what's happening across your organization. Third piece of the puzzle here, segment those vendors. This isn't an end-all be-all list. This is a starting point that I've thrown up here. You want to understand not just the vendors and the product, but what is the impact to your business? Because not all vendors are made equal, and those AI vendors are going to be quite different as well. Is there a significant impact on patient or financial within your organization in a quick period of time? What if there's no impact, right? Is it still critical to your organization? Does it impact business operations? What I'm trying to get to here is that you can't just have that inventory. You really need to start segregating them and segmenting those vendors based upon what the impact is to your organization. What if you had a risk or let's say something bad happened? What is the exposure rating to your organization? What could be the worst possible outcome or scenario? You need to understand that. You need to start thinking about that and run specific scenarios about what those vendors mean, what the product, the service, the solution means, especially with AI embedded into it, and how does it impact your business operations? How does it impact patient care? segment, risk, and tier those vendors to ensure that one, you're taking the right control set with them, and two, you can apply the right control set to them. The fourth thing, again, so you have the inventory, your gut set up with segmentation, you're asking all the right questions. Now start to adjust the risk profile. Based upon the use case, based upon the business criticality, how does it interact with your environment? It may not just be IT. I know we put IT here, but it may not be just IT. There could be a lot of different areas where it's going to impact your environment. Think about environmentals, for example. Are we using AI in our HVAC systems to help determine how hot, how cold the room should be? Should we be rapidly adjusting temperatures on refrigerators, which may be carrying, critical care drugs, things like for cancer treatment, things of that nature? Understand the use case and then adjust the risk profile based upon that use case, because that's going to also change the business impact. Start to understand the data that's involved. Start to understand who's touching it, who's accessing it. Also understand now how that model's being built, right? These are all critical elements that will start to tie into you really thinking about adjusting your risk profile and who requires a little bit more feeding and care than others. And again, you're going to dedicate resources to this exercise. You're not going to be able to cover every single one with 100% resource. So you really need to start to segment those vendors to see who's going to get your most attention. And then use that governance model to trickle down those controls to those that don't get the most attention from you. What happens now when you uncover things that are happening with those third parties, maybe within the AI models, and you want to fix things, right? You want to address the vendor in a way that's going to meet the needs of your organization and drive how you're using that service to run your business or treat patients. Well, here's the idea. Create a corrective action plan. Create a risk register. You can call it whatever you want here. But the idea is that you're going to hopefully auto-generate it. You're going to have a governance model that sets the framework for what your expectations are when it comes time to dealing with these AI vendors and how AI is being used in your environment. And you auto-generate corrective actions or recommended remediation so that, one, you have a standardized set, and that's running across your entire organization. Now you've standardized, everybody's rowing the boat in the same direction. What it also now starts to do is automatically surface security gaps and really gives you now the ability to assign and track remediations, whether it's to the third party external to your organization, or if it's something that has to be done within your organization. By assigning those key remediations and risk exposures, you're now opening up other parts of your organization to be much more enterprise focused when it comes to AI and controlling AI in your environment. The best part about this is, though, is that now you start to centralize this work so that you can see it in totality, right? And the most important element of this is that you want visibility into that variability, because if something slips, you want to know about it. So really negotiating and centralizing your corrective actions, your remediations, that's going to start to create for you a longitudinal risk record of activity specific to what you're doing in your organization to address the AI. What about frequency of reassessment? And this is a question that I get quite honestly, quite frequently, no pun intended. How often, Chris, should we be looking at our vendors? If they're AI vendors, I'm going to warn you, much more frequently than you think, right? This isn't look at the vendor at point of contract and then go look at them again in 3 years. The speed and the evolution of AI that's taking place right now is far outpacing human hands. Take a look at the slide and this information that's being provided here is that AI has really surpassed humans at the number of tasks and rates that it can be performed. It's amazing what you see taking shape out there with this technology. So if I'm only assessing this vendor who may be using AI or maybe providing a service which has AI embedded into it, into my organization, I'm only doing it once every year. But I know for a fact that the AI is evolving with a frequency rate that's much quicker than the human hands are. I'm already behind, right? I've already introduced new risks into my organization. Now, I'm not telling you what frequency you should assess those vendors with. What I am telling you is that you should be assessing them with some frequency, and that frequency should be based upon, one, that tiering, two, the understanding of the use case and the risk that it brings, and then three, that longitudinal risk record that you're creating. Because that reassessment is really going to bring to bear the stuff that vendor has addressed on your behalf. What are the things that you want them held accountable to? Utilize that reassessment to ensure that they're doing the work that they said they were going to do. Also utilize it to ask them the same questions again and see what their response changes to, right? Because they're going to be moving with a frequency that's quite fast as well. And are they paying attention to all those elements of cybersecurity controls or understanding what's required from your organizational perspective to really have an impact on reducing the risk of how AI is being used in your organization? Again, this is part of a two-way street. This isn't just your organizational governance taking this and running with this. This is now really solidifying the relationship that you have with those third and fourth parties to ensure they're doing the right thing at the right time for you. One more thing in this space before we get into reporting structure is that you really need to start to think about governance and start to leverage the entire enterprise, right? How do you drive down risk in this space? It's not just one or two people within your organization that are going to make the decisions about how AI is being used and where it's being incorporated across the care continuum. You really have to start to think about creating collaboration between departments. You need a very diverse set of minds working on this problem. And it can't just be IT related because, oh, it's an IT problem because it's a technology. That's the wrong answer. That is the absolute wrong answer. You really need to look at this from a couple of different lenses and really get the entire enterprise involved. I'll give you an example. I remember not that long ago, it was that long ago, by the way, we were really focused on hand hygiene, right? How do we get practitioners to ensure that they're washing their hands, right? For right, wrong, and different, to prevent infection. We deployed a number of technologies to help solve this problem, and then it became an IT issue for hand hygiene. This is the wrong approach. At no point in time did anybody in my department, or should anybody in my department, been solely responsible for hand hygiene and driving down infection within the hospital. We play a role. There's no ifs, ands, or buts about it, but we can't own it. The idea of enterprise risk and driving it down because you're leveraging everybody across the enterprise brings different perspectives to solving the problem, brings different perspectives to creating solutions. And that's all that this slide is trying to say. Get everybody involved, whether that's procurement and who's buying those solutions to understand when they come in the door, IT to evaluate them, clinicians to evaluate the use case specific, get quality involved to understand the model and the data and what the outcome and output's going to be. It's not a one size fits all. It's going to be based upon the maturation of the organization, but the maturation of the organization is important here because, again, it can't just live and breathe with one part of the organization. It's got to be pervasive across the entire enterprise. Finally, align AI strategy and cybersecurity around what we consider core risk themes. So again, you're not trying to boil the ocean. We're trying to simplify how organizations understand where AI is pervasive in their organization, those use cases, those models, and where could it have its largest impact to the organization. So if I think about how we align AI strategy as a governance perspective, we want to manage it to board level based risk themes. Now, these may not be the risk themes that you're using within your organization. You may not be using risk themes at all, but I would recommend that you start to think about how you convey that message up, get that into these hands of the executives and tie it back to those key themes such as patient safety, how it impacts privacy, confidentiality, how do you safeguard financial assets, and maybe you're in a growth mode. So what's the complexity of adding new technology while you're going through growth? It's good to have it at that top level theme, but you also now start to have to drill down, right? So as I start to think about, as we get more downstream and how the rubber's going to hit the road, you really got to start to think about how you communicate risk in business terms. And this is where it starts to come to bear for risk statements. Look at those key threats that impact those themes, and then drive a tactical operational risk, a detail, a manageable list to address those risk statements and address those risk themes going up. This is just a starting point, right? This is just really an organization trying to understand what the risk of AI strategy means to them, and then how the technology starts to incorporate itself there and really start to drive home that key common message. And then finally, communicate that risk. So best practice, connect everything back to that core risk theme. I want organizations to start to think about how we communicate risk, especially with the advent of new technology like AI risk, to the board in deeper, broader business terms. right? Be intuitive, non-technical. Um, I think non-technical is going to win every single time, because if I can tie it back to that theme, that's what people really start to understand. So connect everything back to those core themes. Use a standardized framework for how you communicate risk consistently. There's a dozen of them out there. Find one that works for your organization and use that in a consistent manner. Meet your audience where they are. Again, that requires organizations to understand who is a member of that board of directors. Is it somebody with deep technical knowledge and expertise? Maybe you have to change the message slightly at the reporting to meet them where they are, meet their needs. More importantly, be empirical, data driven, build credibility and trust. Don't say this could happen because, or maybe. Be empirical. Go look at use cases, understand your data, understand where the significant shortcomings are, and communicate those shortcomings. And again, using dashboards and benchmarking, that helps, because it helps justify your resources and your investments. Now, again, this is a journey. This isn't something that's just going to happen overnight. But I can't stress enough, it starts back with that governance, right? Really having somebody accountable and owning the program, soup to nuts, to ensure that your organization can take advantage of these advanced technologies without sacrificing not just your business and the brand of your business, but also the safety to your patients. And then this final bullet right here, justifying resources and investment, compare yourself to others. You know, this can be a sore subject sometimes, but it's a very powerful tool when you start to think about, how does my organization stack up to another's organization? Luckily, we are doing this quite frequently, and here's an offer for everybody that's on there. We're actually enrolling participants for our wave 3 of our cybersecurity benchmarking study, right? We're starting to take a look at AI and its pervasiveness across organizations, but we're bringing it back to security frameworks, right? Really the blocking and tackling necessary to ensure risk is getting addressed within your organization. So participants will actually self-assess for things like the healthcare industry cybersecurity practices, the NIST cybersecurity framework, and then organizational-based benchmarks. And then we will correlate that data and provide those findings back to give access to summary and final summary reports and aggregate it based upon peer groups as a direct comparison to who your peers are, right? To be able to slice and dice that data, make sure that, one, you're getting the proper coverage that you need, you're performing at a high level, and you're investing your money appropriately to help prevent risk and drive down that threat landscape across your entire organization. So with that said, I'm going to kick this thing back over to Riz. I want to thank everybody again for their time, their patience, and their attendance. I hope you gathered something from the slides that were presented today and the dialogue that was presented today. And I'll open the floor to ask if there's any questions that I can hopefully answer.
Thank you, Chris. What an amazing presentation that we got to listen to today. Now let's dive into a few questions. Our first question here is, how do the organizations know the right AI to use?
No, so that's a great question. It's going to boil back down to your governance strategy. What is your strategy as an organization? How are you adopting AI? What are the use cases for it? As you start to understand where you want to adopt AI within your organization, then it's time to go look for the right solution to meet that need. And that right solution is going to have a lot of caveats behind it, right? So again, if I'm using it in patient care, how's the model built? Is there bias? Should I be thinking about it from a privacy and security perspective a little bit deeper because it's patient care driven? It's all going to go back to that governance, right? That model for governance that you're building as an organization. And I can't stress enough, one of the things that I said before, that governance model has to be diverse in nature and in thought, right? Because you don't want to get something wrong. Start small. Do not boil the ocean here, right? Use it for 1-2 use cases tops. Expand from there. Find the right provider to support you based upon that use case and what your expectations are, and grow from there.
Thanks, Chris. We have another one here that says, what do you recommend as the best processes for certification in AI?
Ooh, that's a doozy of a question. I don't even know if there are certifications for AI just yet. I think we're just starting to eclipse that. You know, so I'm going to frame this a little bit different way. Think about from the perspective of patient care. most organizations are going to have a chief medical informatics officer, somebody with a clinical background in the quality section of within their healthcare delivery organization. Team them up with a level of expertise from the technology side of the house, and then somebody from compliance, right? So it's not a certification per se, but it's allowing people to start to look at how AI is pervasive and how it can be used in your organization. Now, it's a great question. I don't have a direct answer for you. If I do run across something, though, I'm more than happy to share that back out. So whoever submitted that question, please shoot me a note at the email address that you see on the screen there. And I'd love to keep this dialogue going, because there's going to be something that surfaces, and I want to make sure that I get it back to you in an appropriate and timely manner.
Fantastic. Thank you. The next question is, how should we begin to put a governance framework in place and formulate an AI strategy?
Yeah, so I think we started to scratch the surface on this one. You really need to have that diverse set of thought, diverse set of individuals with a lot of different skill sets that come together to really start to solidify and understand where AI is going to be used in your organization. Is it going to be strictly for business automation right out of the gate? Are you going to be looking at it potentially if you're doing research? Is there an opportunity for research in that space? Or are you going to incorporate it directly into patient care or other business operations, right? Have that group explore what the possibilities are. Own it at an executive level to say, this is the strategy we're moving forward with, and then have that group go out and establish who you're going to do that business with and set guidelines and parameters around it. Ensure that policy follows that governance. Incredibly important that whatever you're going to do, say you're going to do it and put it down in writing, and then educate. I can't stress this enough. We do a lot of governance work across the industry, but do we ever educate everybody that's involved with it? And in this case, it could be everybody within your organization, right? So you need to make sure that you have a wide net to cast as you educate what the path is that you're taking forward from a strategic perspective, what the guardrails you're setting up are, and then what people's responsibility is when it comes time where the rubber hits the road, and how they're going to be engaged with that technology to satisfy whatever that strategic vision and mission is.
That's great. Thank you. So this question says, how would you recommend starting to educate both employees and patients on the risk and appropriate use of AI?
This is another great question. I'm going to go back to the good old days of healthcare security 101, probably 25 years ago. For the employee base, it's really getting engaged with them at the point of entry. So as you're educating them, and everybody has to go through education within your healthcare organizations, it's mandated, you have to do it. Start to have the conversation, right? It's no different than when social media started to kick around. We had to start having the conversation about how people were using social media in their personal lives and how it was bleeding into our business operations in the healthcare system. We had to make them aware of the privacy and the risk-related activities and the security-related activities of what they were doing in their day-to-day lives and how that could impact the healthcare organization. So start to incorporate that high-level education right out of the gate. Make it a part of that mandatory training package so people understand what it means to the organization, first and foremost. What's our strategy? This is how we're using it. This is how you're engaged with it. Secondarily, how are you using it in your personal life? Is it derogatory to you? Is it a negative in your personal life? Really start to roll that up and make people realize this intersection of digitization. It's not just within the four walls of your hospital systems. It's also within the four walls of their homes, or within their car, or at the coffee shop. That's how pervasive it is. It's going to be a part of their everyday existence. Make them aware of it. Make them understand it. When it comes time to the patient, I mean, I'm no expert on patient education. I get a lot of patient education based upon the services that I consume. It's got to be upfront and personal as well. So as I'm diagnosing, or as I've gotten my diagnosis, one of the best things that I've had happen with me is I've had a conversation with my practitioner. My general practitioner always sits down and says, this is what's going on. This is how we got to this conclusion. You should be having that conversation with your patient as well. Do not go out and self-diagnose. It's a great tool to understand some things, but you should be really getting that information from the source of truth, and you should be coming back here for that information. So it's really that dual-pronged approach, that have that conversation face-to-face, provide them with the information that they need to be successful in their diagnosis, treatment, and care. So two approaches, one for employees, one for individuals. They both meet back in the middle, though. And why I say that is because this is now pervasive. It's a part of our day-to-day lives. I can guarantee you that there's probably 80% of us that are on this webinar right now that have used ChatGPT for something. Doesn't matter what it is. We've used it for something. We're going to continue to use it. And now has to be part of the incorporation of every conversation that we're having as we continue to watch the advancements take place in the space.
Very interesting. Thank you. Our next question says, where can we see sample AI governance models?
You know what's funny? I'm gonna give you an example. Go to ChatGPT and ask for one. See what the output is, right? I want you to use it and I want you to understand it, but I want you to take caution and take measure. You know, we're just starting to see a lot of governance models take shape out there. I know the National Institute of Standards and Technology has a new published document that just came out a couple months ago about governance and what you should be looking for from a risk perspective when it comes to AI and AI model generation and usage. So I would recommend that, one, take advantage of the AI, go check it out, see what it says, but then also go, and this is not a shameless plug for the NIST, it's just a great resource that they have there. Go take a look at that NIST resource about governance and AI and compare the two. See how they line up, see where their differences are, right? One was written by human beings, one was trained on models based upon writings by human beings. See if they match up, see where they combine, right? I think it'll be a very eye-opening experiment for people.
Great advice, thanks. Our next question says, what's the best way to know what kind of fourth-party AI risk exposure we have?
This is a wonderful question as well. And I'm going to go back to that digital inventory or an inventory in general of your third-party service providers, right? So if you're doing business with somebody within your organization, you should know who those folks are that you're doing business. You should have as a complete an inventory as humanly possible. Now, this is it's really tough to get to the bottom of this because we've lived in silos. For every business has lived in a silo for some form or fashion for a number of years. So it's really going to require you to go out and pull the enterprise and truly start to understand where all your third parties are. Why that's important is because once you have that comprehensive list, then you start to really dig into, if you're, grading these appropriately based upon the impact to your organization, focus on those critical vendors that you have. Ask them questions, send questionnaire, do something to understand how their product or service interacts within your organization. Ask them flat out, who are the fourth parties that you're doing business with downstream that could have an impact to how your service is provided within our organization. But you got to start somewhere. And I think that inventory is that first starting point to really start to get visibility into what could be a problem for your organization, right? Centralize that inventory as well. Don't just make it available to yourself. Make it available to the correct people across the enterprise who have influence or a sphere of influence into that purchasing, that buying, and everything else that's going on to bring those new vendors into your organization. And again, we're just starting to scratch the surface here, but once you get to that point of visibility and you can start to see the things downstream, it's going to open your eyes to how pervasive the healthcare ecosystem is and the products and services that are being delivered back to you to provide for your business or provide to patient care.
Fantastic. Well, that is all we have time for today. I want to thank Chris for an excellent presentation and Censinet for sponsoring today's webinar. To learn more about the content presented today, please check out the resources section on your webinar console and fill out the post-webinar survey. Thank you all for joining us today. We hope you have a wonderful afternoon.